All right, well, my watch says it's time.
She might join. She just said I can't.
All right, well, I'm going to call the meeting. Good evening, everybody. I'm calling to order a meeting of the Human Affairs Committee on November 20th, 2023 at 7 p.m. in the Aldermanic Chamber. Madam Clerk, would you please call the roll?
I most certainly will. Alderman at Large Gloria Timmons.
Here.
Alderman at Large Melbourne Moran Jr.
Here.
Alderman Patricia Klee. I am here. Alderman at Large Shoshana Kelly. I think she is trying to get in on Zoom. Alderman Chairman Thomas Lopez.
I'm here.
And we have 4 present.
Also in attendance, Julian Long. Anyone else that I don't see up there? Also in attendance?
Oh, I'm sorry.
I said Julian Long. Is there anyone else out there in the audience?
There was a number of people, and right now my mind is blank as to the names. So
All right, you guys can introduce yourselves the old-fashioned way.
Yes.
Okay, so let's start with public comment. Anybody wishing to make public comment, feel free to approach the microphone. Seeing no movement. Discussion. We have a discussion of New Hampshire Coalition of Recovery Residences. Whom among you would like to participate in this? Would you like to grab a seat up here? Have a seat?
Where would you like me? I'm new to this process.
Anywhere. So when we're having a discussion, we
You're gonna
typically
sit right
invite
over
presenters
here,
to come
or
and
right
like.
here. That's fine, the closest
That's
one,
fine.
or?
Yep.
Okay. I'm sorry, I'm new.
That's okay.
That's okay.
When you do first speak, you should give your name and your address for the record, and then periodically, just because we have transcribers who may not be familiar with your voice, just name and address would be fine.
Okay. My name is Kim Block, and I am from Hooksett, New Hampshire. I'm the Executive Director with the New Hampshire Coalition of Recovery Residences.
Okay, awesome. So one of the reasons that we've been discussing recovery housing in particular is because it plays such a role in Nashua, but is also sometimes unclear as to how the city can best support them, what kind of resources are available. Over our last couple of meetings, we've discussed how code enforcement and fire marshal work with them to kind of identify what their needs are, make sure that everybody there is safe, and then try to manage the interactions that the city has in a positive and productive way. Last month we had a presentation from Gatehouse Recovery, and they presented on how they run their programs sort of as best practice models, some things that they've learned and were willing to share with us. And your organization was brought up both times as a major resource to provide to maybe people who are establishing recovery housing in Nashua as to best practices, ways to run things, that kind of stuff. It sounds like your certification is highly sought after. So do you want to tell us a little bit about that?
Sure, I'd be happy to, and I brought some flyers and things that I'm going to leave with you. I brought my annual report, which will give you a really good overview of all the things that we do. So we do 4 or 5 different programs. The biggest thing we do is we certify recovery houses. We started with in 2019. When I started in 2020 in January, we had 18 certified houses, and Gatehouse was included in that.
Mm-hmm.
We are now up to 95 certified houses.
Great job.
And that's about 36 different organizations around the entire state. Those houses generally sit on a 93 corridor for the most part. In Nashua, obviously, with a couple in Claremont, a couple in Keene, a couple in the Dover, Rochester area. But there's a lot of vacant areas in the state. Fortunately, Nashua's working well with recovery housing. And I think it's a good asset for your city, for knowing where they are, knowing that they're ethically run, they're safe places. So certification is a voluntary process. You do not have to, there's nothing that requires you to get certified. It's not a licensing process. We follow the nationally recognized standards set by the National Alliance of Recovery Residences, and there are 30-some standards that have to be followed. We're looking at, is the business run ethically? We're looking to see if they're in good standing with the state, if they have proper insurance. The home has to testify that they are in compliance with all local laws. We look at the physical property. So we are counting the number of people that are in the house, the number of beds that are in the house. We're looking at the attic and the basement to make sure they're not putting people in basement rooms with no proper egress. We're making sure that nobody's being stored in the shed out back, right? And we are looking for 50 square feet per person in a bedroom. And we're looking for one bathroom, and it doesn't all have to be in one room, but one sink, toilet, and shower for every 6 people. We're looking for a community area to gather, a living room. We want a kitchen. We want that kitchen to be adequate to hold all of the people that are in the house, the living room as well. And there has to be adequate eating space for everybody to gather. The eating space doesn't have to be a dining room. And I often relate that to when I was growing up, my mom, her house, you always sat at the dining room table. There was a place setting for everybody. You had a linen napkin to go with it, right? And she ironed all those before every meal, I think. My aunt's house, her sister, it was, you know, grab something out of the kitchen, find a place on the couch, and share your meal there. They were both families, and they're both really warm and welcoming families. So we're not particular that it needs to be a dining room, but it needs to be a family. There are no locks on bedroom doors. People don't store food in their rooms. They store them all in the central area. And the goal of the house is trying to make those people connect together and learn how to be a family again and learn how to have those trusting relationships. We know that when someone is in active addiction, they isolate. They cut themselves off from all of the personal relationships that are so crucial for our survival. It's really difficult for them to go back and rebuild or build new relationships and build healthy relationships. They really don't know how to do that. So that's really what the Recovery House is teaching them how to do. That's the most important thing, is teaching fellowship, teaching accountability, teaching relationship building. 12% of Americans right now are suffering with addiction. That's gone up in the last 5 years from 10%. I'm sure there's a lot of reasons for it. I think COVID is one of the reasons, the isolation that happened in COVID. Isolation will bring on addiction. I think that we live in a divisive society right now, and that causes a lot of anxiety, a lot of trauma. And trauma in general is where we think addiction starts, and that's how each individual can cope with trauma. Unfortunately, some people turn to substances to cope with the trauma. What's really cool is that, you know, the substances give the person the endorphins they need to live with the trauma. They want to do anything they can to get rid of that pain. The substances get rid of the pain. What's very cool is our interaction with other people that we meet in society. People at the grocery store, our neighbors, the people we live with, they provide the same sort of endorphins as drugs do or as alcohol does. And it will help someone get to long-term recovery, which is the goal. Inside the house, you'll see that people have roommates, and it's usually 2 people in a room. Sometimes there would be 3 if the room is particularly large. But we want to see typically 2 people in a room. The reason for a roommate, even though everyone in a recovery house is an adult, is that isolation, right? We don't want people to isolate, and people will wake up at 2 o'clock in the morning with a craving. All they can think about is going out and finding that quick fix, that the thing that makes them feel a little bit better, that takes away some of that pain. And their roommate has guaranteed them that they'll sit with them through that 20-minute craving and help them get to the other side of that craving. And it helps keep that person in the house, and it helps them achieve another day. So we find roommates really important. We are looking for the house to have structured times to build the family. So typically they have a weekly meeting where everybody comes together and they talk about what chores do people have. Everybody shares chores in the house. Accountability. Did somebody steal somebody's cookies? You know, and that's a big problem, honestly. But it's part of learning how to live together and how to build trust with each other, and how to trust that you can leave your cookies in the cupboard and someone else isn't going to violate your trust and take them, because most often people would freely give them. They're learning in those meetings how to celebrate somebody else's successes. So minor success, maybe they got a chip, You know, they made it another 5 days, they got another chip, or maybe they got their license back, or they've gotten a new job. Those successes are celebrated. Could be with a high five, that's totally fine, because again, every family is different, right? Your family is different from your best friend's family. When you were growing up, things happen differently. So we want to see celebrations. We want to see holiday celebrations. So some people will go back to family members and celebrate with family members, but we want to see whoever's left in the house that they're gathering. This weekend they will be having Thanksgiving dinner in almost every house. Or if it's not in every house, then several houses will combine together to have a big turkey dinner together, which is really critical. We know that there are curfews in the house. Typically, they're stepwise, so it may be when you first move into a house, your curfew is 9 o'clock, and as you increase in your time there, then it might extend to 11 o'clock. Typically, it's not later than that. We want to know that there are random UAs. Typically, when someone has left for a weekend away and come back, they're going to be UA'd on the way in the door. They're also going to be UA'd randomly to make sure that they are being accountable for what they've said that they would do in their sobriety. We need to see good neighbor policies. So the house has to look as good as everybody else's in the neighborhood. It will not be the worst house on the block. There will not be trash outside. There will not be things in bad repair. There will not be dead cars in the yard. And there will be parking policies by the house that don't infringe on the neighbors, right? So there are rules about parking. There's rules about language. There's no foul language outside the house. There's no yelling and screaming outside the house. So they're good neighbors, quite honestly. They're decent neighbors. It's probably the only house you can count on in the neighborhood where everybody is sober, everybody is actively engaged during the day, so they're either employed, looking for employment, they've gone back to school for education, they're volunteering. So they have to be active during the day. It's not, you can't sit around and play Game Boy. It's not allowed. We want to see them get involved in the community and do some volunteer work and be accepted in the community. We'd like them to be a positive effect on the community. Overall, the community benefits because, as I said, everybody's got to be employed. So you have 2 levels of employment coming out of a recovery, or employees coming out of a recovery house. The first level would be, we expect that people, for the most part, are going to be seeking get-well jobs. A get-well job is going to be something at Dunkin' Donuts or McDonald's or Cumberland Farms, something that is part-time, low stress. They can leave, they can go to work, they can do their thing, they can leave it and leave every other work. They're not bringing home stress from work. Because at that point in time, they're still working on their self-esteem and they're working on their own recovery. They're going to meetings, they're working on their health, and they're working with counselors on their own recovery and that progress. Once they get really a good, firm stance there, then we're looking for a sustainable job. Something that they can support themselves over time with insurance, benefits, and with an income where they'll be able to move out from the recovery house and go on to their own apartment, buy their own house, start their own business, pay their taxes, take care of their children, take that load back off from the city back again, and be productive members in our society. The rate of success is overall, of all people that enter or that suffer from addiction, 60 to 75%, depending on what data you're looking at, achieve long-term recovery, and long-term being more than 5 years. That's a pretty good rate. If you go to treatment for 28 days or for 90 days, and you leave and you return to the place where you were before treatment, or you don't have supportive housing to go to, it's unlikely that you can maintain recovery. Some people will. It's not likely. It's unusual for that to happen. And so typically that person will have recurrence and they will end up going back through treatment again. We know that from the time that addiction sets in, We know it's 4 to 5 years before somebody will seek help. Once they seek help, it's about 8 years before their disease goes into remission. And remission is achieving a period of time without a recurrence. And in that 8 years, they, on average, will go back for treatment 4 or 5 times. And then it's another 5 years before they reach full remission. And that's when their risk of overdose reaches the same level as the general population, which is 15%. Overall, on average, it's 15 years for somebody to reach that level of remission. If they are supported by wraparound services, which would be RCOs, and doorways services and counseling services, health support, good jobs, and recovery housing, we can compress that timeline to 5 years. That's phenomenal. And that's what Nashua should be seeing with the recovery houses. We are just starting to collect data in New Hampshire on what is a length of stay. We see 2 different lengths of stay in houses. We see people that come in and in the first 2 months, they'll cycle back out very quickly because remember, on average, people cycle through treatment 4 or 5 times. It may be as many as 45 or 50 times that they go through treatment. We know there was just a famous actor, Matthew Perry, that passed. He said that he'd been through treatment 65 times.
Yeah.
It's not uncommon. On average, it's 4 or 5 times. So we'll see in that first 2 months that someone will cycle out. What we understand is that when they're in treatment, their feeling of well-being is pretty stable because they're feeling physically better, the chemicals are getting out of their system, someone is telling them what to do every moment of the day, where to go, what to eat, when to go to bed, right? When they come out of that, even when they go into a recovery house, all of a sudden, all of those decisions are on them and they have to make a lot of decisions about where am I gonna go, how am I gonna get a job, what am I gonna eat, where am I getting my groceries from, how am I getting from point A to point B? And it's tough. And they still want to isolate at that point in time. And that makes it tougher. If they can get through those first 2 months in the recovery house without leaving, and remember I said roommates are really helpful for that, then we see them stay 9 months, a year and a half, up to 5 years in the recovery house. And we see great success after that happens. So we see 2 different groups. One group will spin out fairly quickly, and the other group will last for a long time. And they'll have really good success. So we see recovery houses also as for the benefit of the city. Again, you know that the house is not, there's no active drug use, there's no drinking alcohol at all. And they are eligible full-time employees that are gonna be there on Monday, because the house isn't going to let them sit around. They're being held accountable to be there when their schedule is. I said a lot. I don't know if you have some questions.
Most likely.
Yeah.
So just as a housekeeping note, Alderman Kelly did log in around 7:04.
7:03.
7:03, okay. So I guess we'll start with the members of the committee. Alderman Kelly has she's just
I always have a few questions, but
Good.
This doesn't have anything to do with the questions, but just for the public and so on, and as for myself, you mentioned something called an RCO, and that is?
A recovery center organization. So it's a place where they can get connected to services, but there's also activities that may happen. It depends on the organization.
Revive, Alderman Cleese.
Yeah.
Oh, okay.
That closest
Yeah.
one, but there's
Yep.
others.
Yeah, thanks. That explains a little bit more to me. One of the things that kind of hit me was when you talked about how when they're in this program and so on, they're being told every day what to do, when to get up, go to work.
During treatment.
Right, during treatment, yeah. And how to basically take accountability for every hour of the day. I found that working with Department of Defense, a lot of time that happens with our military too, is that they're told for X number of years when to get up, what to do, and when they get out, it's like, okay, now you're on your own. So I like the fact that actually the military is now taking on you're out, let us help you along the way too, to kind of acclimate. So I think that's great that you're doing this. I'm also very supportive of recovery homes.
Thank
We
you.
hear too often, people will say, I don't want that kind of home in my neighborhood. But as an alderman, and I'm sure other aldermen here, we get complaints that their neighbor is not a recovery home, but that just general public, a neighbor is not keeping up their lawn, or they're having fights or parties or so on. And it sounds like this is not something that's going to be happening here. So it should be something we celebrate and invite into our community and into our neighbors. So I really do thank you for this. I kind of, I don't know if my mind wandered when you were saying it, but you were talking about the length of service. Could you repeat that? You said something about some people cycle in really fast, like within 28 days, and then I thought I heard you say something about 5 to 9 years. So
Right, so some people, the treatment is 28 to 90 days,
right.
okay? And that's before you go to a recovery home. When someone is in treatment, I was talking about, we know that they feel pretty stable. They feel if we look at a wellness curve, they feel pretty stable at that point. When they leave treatment, their feeling of well-being drops drastically. And that's when we see they leave treatment and they go to recovery housing. When they're in the recovery housing phase, in those first couple months, because it is so hard, they may leave in those first couple months. We see a group of people that do. But if we can get them through that period of time with enough support, then they'll hit this lowness in the curve, and it will start to really climb when they start to make those connections with the other people in the house, when they start to bring in community, when they start to make relationships. Then their feeling of well-being will climb quickly, and they will end up staying in a house. We're hoping 9 months to a year and a half for really, really effective time in the house. But people, especially with this economy and the housing market, they may be there for a year, 2 years, or 5 years. And part of that is driven because it's really difficult to find an apartment.
I appreciate it. One more comment?
Sure.
Thank you. I appreciate you saying that. My brother was in rehab. He's now since passed from drug-related illnesses. But one of the things, he had been in rehab for about 30 days. He actually, from Massachusetts, he actually came here to New Hampshire for rehab. He left talking about it being a success. That very first Sunday, we all went out to eat, and he ordered a Bloody Mary, and we kind of looked at him and said, what are you doing? He said, oh, I was there for cocaine. He did not make the connection of one addiction is the same as the other. So I guess my question is, as part of the treatment program, you try your best to make everybody understand that an addiction is addiction, whether it be alcohol or drugs, or I know you may have to do treatment differently for them, but they do
So
understand.
we're not involved in treatment.
Okay, you're just involved in
We're
that,
just
in the home.
involved in the recovery housing aspect
Okay.
of things.
Thank you so much. I appreciate your time.
Alderman
Thank you.
Timmons.
Oh, thank you. That was very informative, because I always thought why these people couldn't get their act together after so many tries. And one of the things my daughter always said, who's in mental health as well, and she deal with a lot of people in recovery and that sort of thing, that they get better service if they went to Massachusetts. And she was frustrated with the lack of services that New Hampshire have for, let's say, recovering addicts. So now I see a point. I really see her, and thank you, but she should listen to this video, what you were saying, and I'm also going to take some of those, she probably already got the literature and stuff home with me. But one of the things my colleague said about the military, because I was in the military for 22 years, my life wasn't my own, but I did have some autonomy as well, though, because I wasn't told when to come in the house. But I was told that you could be called anytime. You cannot be intoxicated or anything like that. So you know what to do. You know that you can come and go wherever you want, but you just cannot go to the bar and be home at 12 o'clock midnight drunk, because you never know when you're going to be recalled.
Right. Right.
So I understand that the sense of being told when to get up in the morning, when to go to, well, not necessarily go to bed, but when to come in and that sort of thing. So that was pretty interesting that they really do have a similar thing, but we had a goal at the end. And that's my issue. The goal at the end for recovering substance abusers is to maintain stability. But at this time, you're at a certain age. Could you kind of explain that when you said it was like a 15-year span? And so if they started, say, in their early 20s, and 15 years is a long time,
Mm-hmm.
and so by the time they get to that 15-year time span, it may be where it's a little too late. So, I mean, as far as...
I would just want to clarify, this isn't like a ticking clock, and it's a very, very individualized kind of situation. Do you want to explain a little bit more about where the data comes from an unsupported person seeking recovery in the manner you were describing?
Sure, and I can share with you that I know we have a housing assistance program where we take applications for housing assistance, and we get about 50 applications a week for housing assistance. We can only make 5 or 6 awards a week, which means a lot of people are going without assistance,
It's a regional issue.
unfortunately. One of the things that I collect for data in that is age, and on average, in New Hampshire, the person who's applying for housing assistance is 35 years old. Okay, so if that helps that idea. Can you repeat your question? I'm sorry. I just lost it.
I think there was some confusion about how long, like it was, maybe the longer estimate was a little intimidating, and like, does it really take someone 10 to 15 years to fully seek recovery?
Those are average numbers, and the data comes from recoveryanswers.org.
Mhm.
And those are average for across the United States. So does it take everybody that amount of time?
Yeah,
No.
sure.
No, it doesn't. And it depends on the trauma that the person it's very individual. It depends on the trauma the person has suffered. It depends on how they've learned to deal with that and cope with that, what kind of supports they had in their life outside.
Age of onset, like if they started really young and they haven't actually gone through the developmental processes without the presence of that substance and that life and those people in their lives, then that can really, people need to have time to live their life without influence. So there's a lot of life skills that get built together, a lot of social skills. And I think the message you were delivering was that the idea of a recovery home is you're providing a group 24-hour, 7 days a week experience where you get that positive reinforcement of this is what it's like to have these opportunities to live in a family, to be accountable, to share your space with other people. And a lot of those are things that, you know, when you're essentially subject to user behaviors and you're chasing needs and all that, you learn the other lessons. Sometimes you learn other ways of seeing people and understanding yourself and, you know, building your identity. Is that fair?
Yeah, that's very, very clear. Yeah, that is true. And remember that, you know, addiction affects every walk of life. It's not going to select only the kids that grew up homeless.
Right.
So
Not the
anybody who
parents.
experiences trauma or stress, and I can't imagine there isn't anybody in the room that doesn't experience trauma or stress, is subject to becoming, it can have the disease of addiction. So there are plenty of attorneys that I'm sure you can imagine have problems with addiction. There are plenty of surgeons. There are plenty of first responders, airline personnel. I'm sure that, you know, there's plenty of hospital workers. When I go to the different recovery houses and we talk to a lot of residents, I meet engineers, I meet school principals, I meet nurses, I meet daycare workers, I meet everybody. I meet people that are in their 60s, I meet people that are in their 20s. I really do meet everybody. It's not discriminatory. Addiction is just not discriminatory.
Alderman Rand.
Thank you, Mr. Chairman. When I hear your conversation, I think to myself, what can the city do to support additional recovery housing and throughout? And one of the big things is housing in general is an issue in the city. backtrack slightly a bit, but also it's very important to let the public know that when you hear the conversations about, oh, I'm going to go to a 30-day program, 90-day program, that's just the start. You know, there's something called the American Society of Addiction Medicine, ASAM assessment that kind of determines where someone's going to fall based on their needs, if they're withdrawing, where they might be. And part of that assessment is where is their recovery safe housing. And someone may fall at something called level 1, which is outpatient, seeing a counselor or a doctor for medication-assisted treatment, but their housing is not safe in recovery. Maybe a partner is using there, maybe there's some other easy access to drugs and alcohol, where you're put in a situation of those cravings and temptations that are going to cause you to relapse and not sustain any meaningful sobriety. And that bumps that person up to needing residential care, or as an alternative, utilizing sober housing, which is much less restrictive than having someone to be taken out of their entire social concept of life, work, etc., where they can start the outpatient process and be in a safe place to recover without the worry of who might be there, because you have a certification that's meeting certain guidelines to make sure it's a quality place to go. But for us as a city, I think to myself what our zoning looks like. I do know that there's sometimes pushback about where a sober home or recovery home can be placed. I personally think that as a violation of the American Disabilities Act. I think if you want to put a group home for people with autism, they can go anywhere. If you want to put a group home or whatever, sober housing in the middle of a row of mansions, you should be able to do it.
Yes.
And we may take this approach, and I'm just speaking in generalities. I'm not saying the city does this. Attorney Bolton's not here. But you know, there's that concept of, well, it doesn't quite fit in with the neighborhood. It doesn't quite do, like, not saying it, but still saying it. And it's more apt for someone who wants to open recovery housing to pick that house or that they're going to buy and convert it in an area where someone in a back office isn't going to really push it. Do you ever experience anything quite like that in your journeys throughout the state of New Hampshire and the city of Nashua?
We do. And so remember that addiction is not discriminatory. What matters is that the person has choices in where they might be able to go, and that they can find a house where they feel comfortable, they can let their guard down, and they can learn how to grow and learn to make connections. If you take an attorney or a surgeon and you ask them to live in the tree streets and drive their Porsche, they're gonna feel like they're looked at as a drug dealer.
Right.
They're gonna feel on edge the whole time they're living there. They're gonna feel punished for what they've done. They shouldn't feel that way for a disease. They need to be in the expensive neighborhood that they came out of, right? In that same neighborhood where their car fits in. And you know, we have a variety of housing in Manchester. There's a house on the north end with marble countertops. And it has people that work the stock market that live there, right? Because it's where they fit in, and when they want to go for a walk during the day or in the evening, they feel comfortable and they don't feel like the neighborhood is looking at them and wondering what they're going to do next. By the same token, if you have somebody that's grown up in shelters, they're not going to feel comfortable in that fancy neighborhood. And they also need options at the other end of the spectrum, and there's everybody in between. And so we think that you need houses, recovery houses in all sorts of neighborhoods. We need a lot of variety. We need a lot of choice for every different group of people. I know that I've talked with Dave Mara at the state. He's interested in trying to find recovery housing for police officers. They may need to be in a neighborhood where their identity isn't quite so obvious, right? For their own protection. So I think that people have to think about that a little bit too. And that it is appropriate to have the recovery housing in any neighborhood. And I would say you're right, it's federal fair housing law is where it falls under. And discriminating against a house for people in recovery, they're defined as people with a disability. That would be really problematic for the city.
I would point out in defense of the Tree Streets, however, that until recently, we had one of the premier auto detailers over here, so you would see some pretty nice cars going through.
Okay.
Everyone was
I'm
like, "Oh, that's probably
generalizing, but
suspicious,"
You know
and
what
it's
I'm
like,
saying, you know,
now
that's,
let's get vacuumed out.
Follow up.
yeah, I'm just saying you want people comfortable to walk in the neighborhood that they're walking in and feel like they're not standing out and being judged.
So a practical example of zoning issues and recovery housing coming into conflict is essentially on Kinsley and Chestnut, where the Process Recovery is working on renovating the former site of the Kinsley Street Shelter, which was a shelter for women and families, into recovery housing. And they're not being met by any disagreement from the community per se, and the zoning law isn't forbidding anybody from putting anything there. If anything, I would say the Ward 4 is very, very welcoming of people of all walks of life. The challenge is the zoning laws do say that you can't have more than 3 of them within, I think it's like a 800-foot radius, whatever the range is, they're within it. So then they need a variance for that. And there isn't necessarily a danger in a recovery house, but neighbors do feel like sooner or later it isn't about people permanently invested in the neighborhood. It's about people, using the space on behalf of a company. So I think it was important to have you present explicitly, because a lot of the points that you touched upon are the concerns that neighbors would have. Now, obviously, I pointed out to them that, like, functionally speaking, if you were going to actually push back against a recovery housing program, having one move in on the site of a former emergency shelter is not the hill to die on. But the concerns were, are they going to be keeping their area well kept? Are they going to be part of the community? Are they going to be involved? And I can point to the existing recovery housing that we have that are part of the community and move through the community as a group, heading to recovery housing, engaging people that are, maybe intoxicated along the Heritage Trail or in other some more somewhat notorious areas. They'll engage them and they'll bring them to meetings if they can. So they're definitely an active and effective part of the community, even as that emergency shelter had 24 staff presence and was a safe manned location for people in the neighborhood while it was operating. So the strengths of your program, I think, are self-evident when people are educated as to them.
Mm-hmm.
And I think that, to Alderman Moran's point, is one of the things that we need to be doing as a community and as a city is making sure that our citizens and our politicians know what these programs are and what they're trying to do, and how they're being managed. I was interested in one aspect of that particularly, though, because you'd mentioned a parking plan. In the Tree Streets particularly, we're struggling with urban density and not a lot of extra square footage, and the competing needs of the rest of the city and other departments like DPW and trash pickup needing to get by in a timely manner so that they can move on to other neighborhoods, any kind of utility work that needs to be done. So people can't just park overnight. We have an on-street overnight parking program, but it is currently stalled, shall we say, on the initiative of people who don't directly experience those issues or those stressors and might have different economic priorities instead of how do the people in the neighborhood park or get to and from their housing in a short-term kind of a way. How closely are you able to look at that? And is there anything that you're doing to ensure that people who sign up for, or I mean, you can't ensure, I guess, because all you can do is encourage, but as a best practice, are you encouraging sober housing to correctly identify the parking stock available so that people aren't coming here and then finding out that parking is a disaster or a nightmare or whatever?
The recovery home has to have a parking policy for their property. So, if there's only 4 cars that fit on their physical lot, then they have to have a policy for how 4 cars might be allowed to park. However whatever they decide. Is there a seniority, pecking order, what is it? But there has to be some sort of written policy. Typically, people in early recovery don't have a car. It's something they're trying to achieve, but that's not typically something they have right away. Typically, they've lost their license, they've lost pretty much all of their assets for many people that are gonna be in a dense area of the city. So we ask them to show us that, we ask them to attest that they are in compliance with city regulations. But we don't look any further into the parking than that.
We have explored on the Board of Aldermen, putting some kind of requirement that landlords formally disclose in the or in the landlord, or the tenant bill of rights that they're supposed to all be using. They formally disclose what available parking there is specifically, because we have run into a lot of people in that area that will say, oh, well, you can just park on the street, and like, no, you can't. There's no on-street parking. And so people are moving in, unloading their stuff, entering into leases, and then finding out that they have to park in a garage that's 4 blocks away. So that's probably something that as a city we need to focus on. I see Alderman Moran had his hand up. I just want to put out for context as well that if we look at Nashua as a city and as an aggregate group of people trying to seek recovery from a crisis, the Safe Station program was around 2016 to 2020, and it followed our final recognition of the opioid crisis, the scope of it. And from my experience working in the Keystone and working with homelessness, that was where we started to really collectively as a community take sobriety much more seriously, at least in Nashua. That was where we started to see sober housing programs start to emerge and organize and come together. So when we talk about how long it takes someone to be in recovery and how long it takes for a sober house to work, we're still working with very, very new data, because if it's going to take someone 4 or 5 years to really start showing positive, effective results, they're just coming out now. And this is where we're starting to see and refine our best practices in an improved way. It wasn't that long ago when we were looking at addiction, issues as though it was the sign of the devil, or you were somehow an imperfect person and less effective because you were less loved by a higher power. There's a lot of discrimination and a lot of stigmatization of people seeking recovery because they had identified that they had a problem and were doing something about it. Where other disciplines, economic areas, they might encourage it. If you go out and get completely tanked with your golfing buddies, that's socially acceptable because you guys are all playing golf. You must be successful enough to just get all wasted and hopefully not end up with your golf cart in the river or whatever. We allow things under those circumstances where, by contrast, who knows what the story of the guy standing by the road with an open container is. He may have just lost a friend, a family member, any number of things. He may suffer from chronic pain, but we're going to look at him like he's breaking a rule and doesn't have a right to be there, even if he may have nowhere else to be. So there are definitely some areas where socially we wink at some things and then we turn around and point fingers at another. And that's very difficult. We haven't figured out socially what we're doing with this as a group. We haven't self-educated or created the kind of rituals or traditions that are more successful elsewhere. So Nashua's learning, and I think having an organization that's dedicated to ensuring that best practices are being supported and communicating and collaborating and coordinating all of these different groups and even collecting data, that's essential. So I think you're doing a great service.
Thank you very much.
And I just wanted to say that before we get too much.
Thank you.
Alderman Moran?
Thank you. Follow up. I just want to go back to 2 key points I think you made, that, and I think it's very important for the members of the public and other the elected officials around here to hear. Obviously, you might have not guessed this, but I'm in the field myself as a provider. So my observations are very similar, that addiction, mental illness strikes everyone from all the social economic spectrum, and that folks on the higher spectrum get access to care much more quickly because they have access to funds that they can pay and go to California or whatever for recovery. And the lower income folks kind of get the looked down upon type of stigma that we're all familiar with, where it's film, TV, just how they're portrayed. This past election, someone running for alderman at large called them crackheads. So you could see how in-depth that negative stigma is for people in recovery, where that, I know doctors who are in recovery. I know nurses that were stealing fentanyl, who were from anesthesia patients who were under the knife. They didn't get enough fentanyl while they were getting treatment, and that is extremely dangerous compared to someone who might be having an open container on the sidewalk. You know, and these stories aren't heard as much because our society protects like a professionals, for the lack of a better word. And I think it's upon people in the community and others to just keep at it and educating us over and over again. So these stigmas, when they do come, we're not afraid to challenge when they come up, and that we can make effective changes within the city itself. Because I tend to get frustrated at some of my colleagues from time to time who, despite experts and people coming to them and explaining this is what needs to happen, that, well, the director said, I'm gonna trust the director, he's an employee of this city, doing what you said, or this person said that, despite expert evidence from other sources. And it can get wearing, but I think it's upon people like you and others to wear them down until they can't ignore
I work at
the
it.
facts. But that's all I had, but I appreciate your time in coming here today.
And I would suggest that disparity of treatment and viewpoint is very similar to diabetes, right? The wealthy person gets to go for good treatment at some place where they're respected, and the poor person is maybe chastised for eating poorly, you know? It's tough.
Right.
It's tough.
I'm
I know-
glad you brought me that medical analogy, because it's the same, it's healthcare.
It's healthcare. Yeah, and in this case, it's mental health care. Yeah.
Alderman Clee has some burning questions, but I would like to ask a specific one that I was trying to get to before.
Okay.
When you talked about data resources that you pull from, we have, over the summer, pulled together a pretty effective outreach collaborative that was very focused on trying to get accurate data, because one of the things we were finding was that a lot of the reporting that we were doing across agencies wasn't necessarily being verified or wasn't met with the reality that we were finding out on the streets. And so it seems important to make sure that all partners that are available are sharing and collaborating that. Is any of the data that you use or the data that you would have available entered into the HMIS system?
No, it isn't. We are, right now, we're trying to set up a data collection system. It's, you know, we're really fairly new. I've been at this for not quite 4 years. So we are collaborating right now with a system called One Step to take some outcomes data. And we're also collaborating with the Fletcher Group, which has a large HRSA grant. And they're working in rural recovery, but New Hampshire is benefiting from that, to collect, to put together a financial outlook, to look at how many houses there are there, how much does it cost, what is the effectiveness of the services that are found in recovery housing. So we are relying, the data that I quoted is for the most part national data.
Are you familiar with the HMIS?
No, I'm not familiar with it.
So it's through HUD, and it's their attempt at gathering nationalized data. And it has been a project of the continuum of care to get all the stakeholders to use it, to participate in it. A lot of organizations are too small and too understaffed to recognize that, like, this is actually a database system that you can use to get information on people that may be coming in, or even to track outcomes and performance measures for your system. And what we found was that people were constantly creating their own systems, and then they were getting so involved and so in depth with them that it was like almost impossible to switch over to a shared input system that could actually do, you know, deduplication efforts and cross-organizational trending, because that would add another staff member, and you have to enter the same thing into 2 different places and whatever.
Right.
I would definitely encourage looking into it.
I will look into that.
Even if you're not necessarily a HUD beneficiary. And it may be that in encouraging some of the sober housing programs to participate in that, they may gain access to organizations like the Continuum and the resources that they have and improve their collaboration. I know we have a separate substance misuse continuum that was created around the same time as the Safe Station, and there is a lot of duplication of ideas, resources, and best practices, but there is also a lot of shared ground that people can kind of access.
Okay, great, thank you for that.
Alderman Cleet?
Thank you again. My first question is the group recovery, the homes that you mentioned. There's on-site support 24/7?
No.
No.
So recovery homes are peer-led.
Okay.
There's an owner-operator that oversees what's going on, but they are peer-led. So by peer-led, every person is a provider, and every person receives care from the rest of the group. So they hold each other accountable. And like I said, your roommate is gonna stay up with you in the middle of the night if you have a craving. They do have someone who is in their program that has a little bit more experience in recovery, a little bit more recovery capital. Recovery capital is like, it's self-esteem is really what it is. And it's something that we can measure. But anyway, that person volunteers to be a leader, so they volunteer to be the person who's checking on curfew, the person who is, maybe overseeing UAs, who may be assigning cupboards in the kitchen. So they're light duties. They might be making sure chores are done when they're supposed to be done. But there is not necessarily someone there. That person will be there 24 hours, overnight, but there's not necessarily somebody there. We have 4 different levels of houses,
Okay.
and you would see that on our website. And the lowest level is a level 1, and that is supposed to be democratically run. We still have rules, we require rules in place. It was designed so that you could pull an Oxford House system underneath a NAR standard. People in this level, in a level 1, maybe have a year in recovery already, but for whatever reason, they're not yet ready to go out into the community. They still want to stay within the sober home type structure. They would not have as many requirements for as many meetings, if that's what the pathway is. They might only be UA'd when there was a reason, right? Then we have, on the other end of the spectrum, would be a level 4 home. And a level 4 home for us is also a 3.1 licensed facility. So it's got a limited period of scope of stay, and that would have on-site staff 24 hours. And then there's level 2 and 3, which are they kind of merge and together. And it all depends on how much extra support and guidance, how many life skills are taught within the home. So how much guidance do they get on finding a job, writing a resume, balancing a checkbook, although I don't know if anybody has one of those anymore. But those sorts of things, nutrition, meditation, Reiki, all of those sorts of things, gardening, that would be the number of those things would put you in a level 2 or a level 3 home.
If I may. Thank you. Not to belabor that, the reason why I was kind of asking that question was kind of are there zoning issues versus the community issues, in other words? And I applauded you for saying that they maintain the home and no drinking, no anything like this. So they're good community members.
Mhm.
But for the community that's naysayers, that's why I'd asked that question, whether or not there was anybody on site. But the responsibility of maintaining the rules and so on is still upon the owner operator of
Right.
So
Right.
they have to settle that.
And they need to have someone who can respond in a crisis within 20 to 30 minutes
Okay.
of that home. It can't be a remote
It's faster than
person.
a lot of landlords.
Yeah,
Yeah.
no, exactly.
Yeah, we
and-
require that. We won't certify a house that can't do that.
And building on what Alderman Moran had asked about zoning and so on, does Nashua have specific zoning laws that are prohibiting you from opening a facility, a recovery home? Or is it just based on the number of occupants, or is it based on the actual location of a recovery home, period?
I don't have that information. NH Core doesn't run any recovery homes.
Okay.
All we do is certify. So I can put you in touch with other organizations that could answer that question. But I can't answer that question.
The reason, again, that I'm asking for that is I know that through another session that we had here, we were trying to lighten up some of the requirements of of smaller recovery homes and so on. And I'm hoping that we're moving towards that way. I mean, to what Alderman Moran had said is sometimes we hear one thing from one group of people and something different from another group of people. That's kind of why I was
Sure.
going to that question. And I do hope that we're moving to be all-inclusive in all communities. And, you know, within my ward are very low-income housing, mansions as well, middle of the road. And I really do hope that our community is willing to open this up, knowing the crisis that we have. So thank you for all your information. I truly appreciate
Nashua
it.
has been really receptive and a really good city to work with.
I'm wonderful. I'm so glad to hear that. Thank you.
And we hold you out nationally, honestly.
Okay.
So I chair the NAR, the National Alliance of Recovery Residences. I chair their advocacy committee. And, you know, we hold you out nationally as being a really model city to work with.
Thank you. That's wonderful to hear.
You know, we don't rest on our laurels, though, so if you do have some recommendations, feel free to forward them to this board. Clearly, there's enough to learn here that we weren't able to get even a half a handle on it after like 4 months of interviewing and all that kind of stuff. So if you have organizations that are interested in presenting what they do and how they do it, then they're welcome to contact and do that. And if you want to come back in a couple of months or a year, or just update us on what kind of stuff is going on that we should know about, then we're happy to keep learning and keep
Okay, that's
working on
great.
that.
Yeah, because I could go on for hours, you know?
You're very knowledgeable, you're very experienced, I can tell.
The other thing that I want you to also be aware of, and this might help some of the people that are a little bit nervous in the neighborhoods. NH Core runs an ombudsman program, so an ombudsman is a mediator, basically. So if anybody has a complaint about a recovery house, we do have strict rules on what an official complaint, what a concern is, but in any case, we listen to anyone's concerns. We will try and help find a reasonable solution. So if a neighbor was to call us and say, you know, they keep parking on my lawn, then I'm gonna call the operator and say, you're not being a good neighbor. We need to work this out. What's going on? And if they tell me, you know, there's 5 guys outside smoking 10 feet away from the property, by the way, every morning at 6 a.m., then I'm gonna let the neighbor know that's because they're not smoking in the house. It's not allowed. They have to smoke outside. They have to smoke 10 feet away from or more from the building. And it's just the way it is. And it's great for you that they're not smoking in the house because their house is not a fire hazard.
You want to burn the house down.
Right? Yeah, so we'll have those conversations with anyone, and try to bring a good resolution, try to make good relationships. We also find that when a neighborhood is a little bit accepting, the houses will often turn to, if there's an elderly person, they'll be shoveling the walkway and the driveway. You know, the people that live in recovery housing want to give back. They want to make amends to society. They want to make a difference and be contributing members.
You mentioned some
Mr. Chairman,
paper.
sorry, I do have to leave. I apparently have exacerbated my injury, so I am sorry. I'm getting over a surgery. It's got some staples in my stomach. But I appreciate your time, and I'm sorry I can't stay for the rest of the vote.
We do have Alderman Kelly, so we have 3.89 aldermen here.
Thank you.
You have an
Thank you for
in-person
your
quorum,
support.
Tom?
What'd you say?
Do we?
You have in-person quorum?
Yeah, we have 3 people that are here, and that's why I was adding you as a .89, because you're here, but I'm not sure we can count it as quorum.
Thank you.
So just as a final piece of housekeeping, you said you had some flyers or material.
I do.
Would that be something we could accept as a communication and put in with our minutes?
Sure.
Okay.
So I've got a couple copies of our annual report. You would ask for a few more
Yes.
flyers, so there's plenty of flyers there for you guys. There's 2 different styles.
Okay.
One telling you a little bit more about the requirements for certification, and one about the benefits of certified houses.
So rather than print 90,000 copies, we can put them in our meeting, and then everybody can get their own digital version.
Exactly.
So I will entertain a motion to accept communications received during the meeting, the core annual report, and then a brochure about certifying recovery homes in New Hampshire.
Mr. Chairman, I motion for the acceptance of the documents that you had just mentioned.
Okay. All in favor, say aye.
Aye.
Opposed?
Oh, no, we have to do roll call. I apologize.
You have to do
The
roll
roll
call
call.
because
Yeah.
I'm here.
Alderwoman at Large Gloria Timmons.
Yes.
Alderman Moran has left. Alderman Clee, I say yes, and Alderwoman, Kelly,
Yes.
and Chairman Alderman Thomas Lopez.
Yes.
You have 4 yeas.
All right. Thank you very much for your time. Definitely
Thank
be in
you.
touch.
Let me know anytime you want to talk.
Sounds good.
Thank you.
We will do a 1-minute reset, 90-second recess, being generous. And then we'll get back to this giant agenda we have to do.
I appreciate everybody being patient.
All right, now that our clerk has rejoined us, we will be resuming the meeting
Yes, thank you.
when the committee members are ready.
Okay, I just wanted to grab the agenda. That was what I needed more than anything.
Okay.
Okay.
Now, on the note, it says that I will be recognizing urban program Julian Long. Should I have done that a while ago, or?
Yes, no, we didn't. Yeah, we
Just
did
moved it.
recognize Julian, yes.
Okay. Let's move to communications.
From Julian Long, Urban Program Manager, in regards to Urban Programs Department updates, October 2023.
Now, I guess we do have to do a roll call instead of a no objection, or?
No, I think you can do, there's no being no objection.
Okay. Without objection, I will accept the communication and place it on file. Unfinished business?
There is none.
New business resolutions.
R23-169, relative to the acceptance of $90,000 from the United States Department of Justice, Bureau of Justice Assistance into Police Grant Activity FY 2024 Hazardous Device Unit Response Vehicle.
All right. Can I get a motion?
I'm sorry, I was writing. I motion to recommend approval.
Okay. Motion is to recommend final passage. Discussion. Do we have someone here to present? Oh, we have someone here to
Yes.
present.
Kevin Basso with the National Police Department.
Okay.
This grant is through the COPS technology. It's for $90,000, no match, and the funds are to purchase a rapid response vehicle for our hazardous device unit.
Is hazardous device unit bombs? Or?
Yes, bomb explosives, yes.
And you said that it was from you identified
COPS, it's through the United States Department of Justice COPS program.
that. Okay.
So this is through their, they have different categories. This is through the technology.
So we're
category.
accepting federal money that all of our taxpayers have already sent up to Washington back to buy something for our city.
Correct.
Excellent. Any questions?
Nope.
Do we have to roll call for that? or-
Yes, we do.
All right, so would the clerk please call the roll?
Sure. Alderwoman Timmons,
Yes, of cost.
Alderman Clee says yes, Alderwoman Kelly,
Yes.
and Chairman Alderman Lopez.
Yes.
You have 4 yeas.
Thank you very much. Have a good
Next.
night. Happy
Have a
Thanksgiving.
good night. Happy Thanksgiving to you.
Next, we have R 23-170.
Okay. R 23-170, relative to the acceptance of $43,117 from United States Department of Justice into Police Grant Activity 2023 Justice Assistance Multi-Jurisdictional.
Do we have anybody here to speak to that?
Are you?
Did they want you to speak to it? It says relative to the acceptance of $43,117 from United States Department of Justice into Police Grant Activity 2023 Justice Assistance Grant Multi-Jurisdictional.
I'm sorry. Yes, I didn't know there was two. I
You
apologize.
gotta like change your shirt a little so you're like, I'm his cousin. What are you talking about?
So this is we get this money from, it's a sub-grant from Manchester applies it. We get it through Manchester as a sub-grantee. And this is to help with, pay the overtime expenses for all the crime prevention, the crime watch meetings I attend, community events, CRACE training right now, it's big. We've shifted money to CRACE training, actually throughout the school department, some training and equipment.
Okay, can you just give your name as well?
Oh, I'm
in case you're
sorry.
transcribing about
Kevin Basil at the National Police Department.
Awesome. Any questions?
May I just make a comment?
Yes.
It's not so much. One of the things, I just want to piggyback off of something that Alderman Lopez said. Oftentimes we hear, this is grant money, it's still our taxes and so on. And I just want to remind the general public that this is money that's going to go somewhere else. So whether we accept it here in the city for something as worthwhile as this program, if we say no to it, it's going to go to Ohio or Pennsylvania or something.
Correct.
It's not going back into taxpayers' coffers, where it's going to go back to us. So I just want to make that very clear. We accept things like this to benefit the city of Nashua, and I appreciate you and other grant writers and people who come to us with all that kind of thing. So thank you for indulging me.
And further, it is my understanding they aren't just putting like a want ad for money. You actually applied for this. You identified it as a departmental need. Work was done here to say this is something we would definitely have to pursue. So likely it would also be something that if it were important enough to win a grant for, it would be something that we would have to budget for if there weren't a grant. Is that
Correct. Especially with the community programs, we do a lot of different community programs throughout the city, and not just, we have a lot of requests, touch-a-truck events. We attend the Hollis, I should say the Sullivan Farm, had their Apple Fest. We're there. We get requested all the time to have officers spend time with it, like either connecting with kids or connecting with community members. And this is a way to help maintain the budget that we have, so.
And I will speak to that because every year at the Tree Streets Block Party, I ask the police to send whatever they can and whoever they can because it's important for neighbors to feel safe. And you feel safe if you know your officers, you know the people that are around as a resource. You know how they do things and what they're doing and all that kind of stuff. And you guys do a great job of community
Thank you.
policing.
I have a comment.
Alderman Timmons.
Thank you, Alderman Lopez. I also, is where you are most of the time, and we need you to be where I'm at. And I feel safer where I'm at, where you are all the time, so I see what you do. And I will always support the police department and the things that they do. And we're at the Halloween festival, they got the Halloween stroll coming up. You need that extra money, and it's good for our city.
Yes.
All right. So if there's no further discussion, we can vote. If the clerk would like to call a roll.
Sure. Alderwoman Timmons?
You can say Alderman as well. Yes.
Alderman Clee says yes, and Alderwoman Kelly,
Yes.
and Chairman Alderman Lopez.
Yes.
You have 4 yeas.
All right.
Thank
Motion
you.
carries. Next up is the acceptance of $17,400, and I'm just reading this for you since you're writing notes.
No, I'm okay, yeah.
Okay, Madam Clerk?
Yeah, sure. R 23-173, relative to the acceptance of $17,499.75 from the United States Department of Homeland Security and the new and the New Hampshire Department of Safety Inter-Emergency Management Grant Activity 2023 Building Resilient Infrastructures and Communities BRIC Program. Mr. Chairman, I
Motions have
motion.
been incredibly long.
I motion to, for final approval, or final passage of R 23-173.
All right, and we have someone here to speak for it.
Yes.
Name and address, please.
Hi, I'm Emily Mersel. I'm the Director of Emergency Management. I will convey that we need to shorten the names of these programs, but if I wrote BRIC, I wasn't sure exactly anyone would know what that was. But, and it's actually did have a shorter name, Alderman Lopez, and they made it longer. So it used to be called the Hazard Mitigation Grant Program that actually told you what it was, but now they made a catchy name for it. And so this is a grant we receive about every 5 years to update our hazard mitigation plan, which we are required to have if we want to get money from the federal government, and I think we all agree we do. So we will be updating our plan, and it expires August 2024. So we'll be using this money like we had done in previous years to fund some interns who will work in my office to update our hazard mitigation plan, which is a citywide plan. And 5 years ago, in 2019, even though it feels a lot longer than 5 years ago, we were the first in the state to incorporate resiliency into our hazard mitigation plan. So we'll be building that out as well in this next update. Money comes from FEMA, even though it says all this, but it really comes from FEMA. And it does have a 25% match, but it's in kind, so it'll just be my time, which is already accounted for.
So in terms of hazard, can you give me a general definition of that? Because I'm pretty sure I'm guilty of in the past been like, well, isn't a building burning down a hazard? You know,
This is a good question. So the hazard mitigation plan specifically covers and exclusively covers natural hazards. So fires are natural hazards, so you're not incorrect, but we'll probably be talking about wildfires, floods, as we all got to experience in September, tornadoes, all those types of natural hazards. Any other type of hazard, a technological hazard like a dam failure or man-made hazards like terrorist attacks, those are all covered in our other plan, our emergency operations plan, which lists those. There are 3 types of hazards: natural, technological, and man-made hazards. The technological and man-made are covered in our emergency operations plan, and our hazard mitigation plan covers our natural hazards with the purpose of outlining a path forward to mitigate those hazards, aka what should we do in our city to make it more resilient to the changing climate, basically, and the threats that we're facing in the city.
I think a good example of that might have been this past summer when there was some pretty big fires that broke out at Mine Falls, and there's a lot of houses near there that we don't want to see endangered. Is that like an
That's a great
of that?
example. The September 11th flash flood we had is also still lingering for close to probably 300 homes in the city that were flooded. So, so we have some serious and increasing frequency of storms and natural hazards in the city, and including the threat from fires in urban areas is increasing.
Is there a match for this?
There is a 25% match, but it's in kind,
Oh.
so it'll just be my time.
You.
Me, I'm the match.
All right, Alderman Clee.
Thank you. And just to, again, for the public that are listening, this is, when we talk about resilience and mitigation, you're talking about the city trying to do things to stop these from happening to individual homes, but this is not to help individual homes to pay for damage that has been done, correct?
No, but I'll tell you this, if we do not have an approved hazard mitigation plan, we will not receive federal disaster dollars. So if we were to not go forward and not do this, we could kiss goodbye any federal disaster declaration, we would not get the money. And that's happened to communities, and they're very serious about it. So our plan has to be approved and accepted by FEMA. So it'll have to come before this board, you guys will accept it, it'll go to FEMA, and they have to sign off on it. And it's kind of like a hard line that they take, and if you don't have approved hazard mitigation plan that meets their standards, your community and the individuals in your community will not be able to receive funds if there was a federal disaster declaration. And then I'm happy to talk some other time about federal disaster declarations, because everyone felt we should have got one for the September 11th floods, but the threshold's high, and it's even higher for individual assistance, which is very, very rare in New England for there to be damage to the threshold that then individuals would receive money. Get flood insurance, so I'll just say that while I have time.
I'm glad you said those words, flood insurance. And I've spoken to you about this before, and just not to go down the rabbit hole, but for those that are out there listening, do not rely on FEMA monies or city assistance. It's just not going to happen, to be honest with you. You need to have flood insurance to cover yourselves. Your regular homeowner insurance will not cover that. You need a separate policy. And I've spoken to you about that as well, and I've tried to put that out to the public.
And we're working on something for the spring to kind of do an awareness campaign. But the bottom line is, even if you got a disaster declaration, the average award is $2,500. So I don't know what that's going to get you if you lose your home.
Nothing.
Get flood insurance.
All right. And seeing no further comment, can the
Call the roll.
clerk please call the roll?
Absolutely. Alderwoman Timmons?
Yes.
Alderman Clee says yes. Alderwoman Kelly?
Yes.
And Chairman Alderman Lopez.
Yes.
You have 4 yeas.
Yay.
Okay. Motion carries. We're recommending final passage. Next up is,
R23-174, relative to the acceptance of $16,800 from the United States Department of Homeland Security and the New Hampshire Department of Safety into Fire Department Grant Activity 2023 Homeland Security Grant Programs Ballistic Warm Zone Vests. Mr. Chairman, I motion to recommend final approval.
Mr. Presenter, could you give your name and address for the record and go nuts?
Good evening, Steve Buxton, Nashua Fire Chief. So this grant was written with the help of our Emergency Management Director, Emily. We've long been trying to get funding for ballistic protection for our responders on the fire department who will operate in the warm zone during certain active threat type events, and this grant will allow us to purchase them.
Any questions?
No.
It's obviously chilling to consider that our firefighters now need to protect themselves, but I mean, if we want everybody to show up for the 911, I guess we have to make sure they're all prepared. All right,
Did you have a
clerk, please go.
question?
No, I
Okay.
agree with you. So,
Alderwoman Timmons?
yes.
Alderman Clee says yes, and Alderwoman Kelly,
Yes.
and Chairman Alderman Lopez.
Yes.
You have 4 yeas on that one.
Next up is R23-175.
Yes, R23-175, relative to the acceptance of $142,000 from the United States Department of Homeland Security and the New Hampshire Department of Safety into Fire Department Grant Activity 2023 Homeland Security Grant Program, Quick Responsibility Utilities Vehicles. Mr. Chairman, I recommend final approval.
All right. Chief Buxton, would you like to make a?
Steve Buxton, Nashua Fire. Again, so this grant process was facilitated with the assistance of Emily, our Emergency Management Director. And this will give us the ability to have some quick response units for large type events or events that occur in places where we can't get our apparatus to, such as Mine Falls Park, Udicki Farm, stuff like that. But an event like we have coming up this weekend, the holiday stroll, the 4th of July fireworks, these units come in very handy for us. So it'll be a good tool for us to have.
Just a comment that Emily might know, actually. Is there a reason that is not diabolical in nature that we're getting all these Homeland Security grants right now? I know sometimes grant cycles end in at the end of September, and then other times they end in July or June.
This is Emily, Emergency Management. The city has made a wise investment of hiring emergency managers. Other cities do not have the capacity to do this. The grant turnaround time is about 2 weeks over Christmas. So I'll have more of these for you because we're going to be putting in for more stuff. But it's an unfortunate setup, the way the state has it. And we're fortunate that we have the resources to go after the funds because these are 100% funds. There's no match. So we're going to keep going after them and getting the things that we need. And I'm doing my best to help other communities. But Yeah, it's not a coincidence that we're getting them. It's an investment that the city has chosen to make in having, staff available to secure the resources we need for the city.
Then I will definitely invite, as I have with other departments, if you think you're gonna need a special meeting from us, we'll definitely meet. Just give us a heads up and maybe talk to Donna to time it so that if we introduce something at the Board of Aldermen, we can meet afterwards if needed.
The timing worked out perfectly this time, so thank you. I don't know how we timed it out, but it did work out perfectly, and because sometimes it is a tight turnaround on this grant specifically, just the way the state does it, but thank you for that, Alderman Lopez.
We did figure out a couple of months ago that we were always in the wrong position, coming right after the Board of Aldermen meeting. So we moved to this spot, and it does definitely seem to be working better.
No, it's perfect, so I appreciate that offer.
Okay. All right, then if there's no more questions, let's call the roll.
Alderwoman Timmons?
Yes.
Alderman Clee says yes. Alderwoman Kelly?
Yes.
And Chairman Alderman Lopez.
Yes.
You have 4 yeas.
All right, motion carries. We're recommending final passage. Any new business ordinances?
None?
Any tabled in committees?
None.
General discussion? Alderman Clay.
Thank you so much, I appreciate it. Once again, I want to commend you for having people come before our meetings. I find it's always been interesting being on this committee. I've been on it now for 6 years, and we learn things through the grants and the different positions that come here, but having these presentations prior to it, the only comment that I would make is because we have the presentations, we have people in the audience that are sitting there for an hour. Perhaps we could suggest they come a little later, maybe like a half an hour later, so they don't have to sit there for an hour, because I recognize that I'm gonna want a lot of questions because I don't stop. But also I appreciate them having sat there for so long and with their patience. And I know they've worked all day too, but I wanna continue having these types of groups, and if you are chair next time around, I hope that you'll continue that. But thank you so much for all that you're doing.
All right. It is under discussion. Would anyone like to discuss that?
Ditto.
Okay.
I don't see.
So if there's other
Alderman Kelly
discussion,
coming.
let's do public comment. Anybody here in the public here to speak? Remarks by the Alderman Clee. Do you have any remarks?
No, I said all that I want to say right now.
I would just like to comment that this Thanksgiving, Operation Enduring Welcome is collecting to sponsor meals for veterans. Caribbean Breeze is nice enough to prepare those meals because they're open on Thanksgiving, anybody who's not great at Thanksgiving. So we will be dropping those off. If anybody in the public is interested in supporting it, feel free to go to Caribbean Breeze. And then next up for Christmas is going to be Soul Sisters. So just a lot of different people trying to help out in the community. I want to make sure the public was aware of that.
I have my hand raised, Alderman Lopez.
Alderman Kelly.
Thank you. I just also realized that we're not meeting until after Thanksgiving. Wanted to remind people that we do Plaid Friday in Nashua, which is the opportunity to come out and shop in local stores instead of giving into the big box Black Friday. So I'm excited to be there. I hope I'll see many people there.
All right, sounds good. So everybody have a great Thanksgiving. Be safe. I know, especially Wednesday, when everybody decides to celebrate Thanksgiving a little earlier. Everybody please be safe and make sure everybody gets to make it to Thanksgiving. And then enjoy your weekends. Can I have a motion? Oh, we got a
Alderman Kelly.
Alderman Kelly.
Move to adjourn.
All
By
those in
roll
favor
call.
say aye.
Aye.
Wait, do we need a roll
Gotta
call
go
for
by
that?
roll call.
Yeah, we do have to do it by roll call,
All
yes.
those who
I
roll call, roll
apologize,
call.
yes. Alderwoman Timmons?
You sure it's me?
Yes, it's you, I know.
Yes.
It's been a long day. Alderman Clee says yes, and Alderwoman Kelly,
Yes.
and Chairman Alderman Lopez.
Yes.
You have 4 yeas,
All right, we are adjourned at
8:23.
8:23.
Good night.